This is Healing Your Eyes with Chinese Medicine by Dr. Andy Rosenfarb. Chapter 4. Chinese Herbal Medicine. Chinese Herbal Medicine is one of the main branches of classical Chinese medicine. It is often used in conjunction with acupuncture or can be used as a whole therapy. Chinese herbs are remarkable in their ability to promote the body's effort to heal and strengthen itself. Unlike Western medications which simply control the symptoms by masking them, Chinese herbs treat the underlying conditions and clearly address the root cause. It may take a bit longer to feel the benefits after taking the herbs than after taking certain Western pharmaceuticals. However, they rarely cause unwanted side effects such as those often associated with prescription medicines. Knowledge of the medicinal use of Chinese herbs has accumulated over thousands of years. It is said that early herbalists observed which plants that animals in the wild would consume for various maladies. For example, some animals eat specific herbs after sustaining a physical trauma, and some eat specific herbs after feeding. Modern herbalists usually draw on ancient formulas that have been successful for thousands of years and helping people get well. Our modern high-stress diet and lifestyles have reduced many people's sensitivity to classical Chinese herbal formulas. Therefore, increasing the potency of some formulas has proven to be more clinically effective and in some difficult cases. Adding and subtracting herbs and increasing or decreasing the quantity of specific herbs can adjust the therapeutic actions of the herbal formula. Chinese herbs are most often combined in recipes or formulas, in which the synergy enhances the medicinal effectiveness. Herbal formulas can range from 2 herb formulas to 30 herb formulas, depending on the patient's condition and the therapeutic action desired. More is not necessarily better. Each formula is created with detailed knowledge of each ingredient's therapeutic action and possible side effects. Some Chinese herbs are contraindicated for specific medical conditions and may negatively interact with other medications. A well-trained herbalist knows those red flags, conditions, and contraindications. He or she will adjust your herbal prescriptions as needed for your specific condition. Traditionally, Chinese herbs were decocted or brewed in hot water and shimmered. These teas were consumed daily until health was restored. Topical application of herbs was also a common practice. Modern technology has made it much easier to take Chinese herbs in other forms including pills, capsules, granules, powders, topical ointments, and concentrated tinctures. Despite the convenience of pills or tinctures, raw herb decoctions remain the most potent means of consuming Chinese herbal medicine. In addition, there is more freedom to craft formulas for each person with the highest probability of absorption and utilization. I can't overemphasize the superiority of using raw Chinese herbs to other forms. They are the most highly absorbable and highly concentrated. As we age, our digestion and absorption capacity diminishes, and decocted teas absorb much better than any other form of herbs. A Chinese herbalist can construct the best formula for you, but it's a good idea to make sure the practitioner has some experience and training in using raw herbs to treat eye problems. Fortunately, there are quite a few herb companies that will prepare decoction prescriptions for you. They can be restored for up to a month in liquid form and just need to be heated and consumed twice each day. In my practice, I recommend raw herbs for many patients with degenerative vision loss. Granules and tinctures are probably my second choice for effectiveness. There is also flexibility to modify formulas, and they tend to last longer. Although retinitis pigmentosa, in TCM, retinitis pigmentosa, or RP, is caused by congenital deficiencies in the liver, kidney, spleen, and stomach, as well as dryness of blood circulation. The treatment principle for RP, or retinitis pigmentosa, and associated conditions lies in regulating the 5 internal organs, nourishing vital qi and blood, and invigorating the entire meridian system. Although each case is different, I find that there is often decline of kidney yang. Using herbs that ignite the kidney yang activity in the body seems to bring about the best results and improvements. RP is frequently a case of cold stagnation. RP is one of the more challenging conditions to treat because it seems to take unusually long to see results, 6 to 12 months. The herbal formulas below are also effective for Usher syndrome and choroidal dystrophy. Main patient formulas: Joel Gui Tang, restore the right decoction, and Bu Bu Shang Ji Ki Tang, or central Qi Tea. Diabetic retinopathy. In TCM, this condition mostly occurs at the late period of diabetes, owing to the deficiency of both Qi energy and gene substance. A long-term deficiency that tends to cause poor circulation and blood stasis. Therapeutic action is aimed at nourishing the spleen and kidney and stimulating blood circulation in order to resolve stagnation. The medicine has the following functions. Since peripheral visual field is weakened in diabetic retinopathy, or DR, the clinical objective would be to strengthen the yang. I have found DR to respond more rapidly than most eye conditions, usually in just a few weeks, and improvements can be obtained extremely rapidly using acupuncture and Chinese herbs with results observed in as little as few treatments. Main patient formulas: green tea and Zhou Gui Tang restore the right decoction. Retinal vein and artery occlusion. When retinal occlusions have formed, the strategy in TCM is to activate the blood circulation and resolve stagnation. It is confirmed that occlusions may lead to retinal bleeding. The goal is to first stop bleeding as soon as possible and then improve the structural integrity of the retina and macula. The generation of new blood vessels and further complications can thus be avoided. As long as people can tolerate these herbs, they tend to work very well. Chinese herbs that help promote circulation of qi and blood can be difficult to digest. Herbs for this condition can be hard on the stomach and cause digestive upset and loose stool. This can be avoided by graduating the dosage and taking it as decoction after meals. Main patent formulas: Shangxi Pain and Yunnan Paijiao. Modified Sui Fu Chuyu Tang. Move stasis in mansion of blood. Open angle glaucoma. Open angle glaucoma is primarily due to blood congestion and fire toxins, with an underlying deficiency of the liver and kidney, or yin. The treatment modalities are primarily focused on moving qi and blood to relieve heat and fire toxins. The clinical strategy is to keep the intraocular pressure low and thereby preserve the vision. I have found that if this condition is treated in the early stages, patients with open angle glaucoma respond very well to herbs and acupuncture. If the condition is progressed, it may be more difficult to get a positive response, especially if there is long-term usage of glaucoma medication. It seems as though most people's vision improves. However, if a 50-50 chance whether the pressure will lower, excessive medication and/or high emotional stress seem to keep the pressure from lowering in open angle glaucoma. No herb, needle, drug, or knife can overpower the effects of negative human mind over the body. In most cases, I do see very good results with modifications of Chinese herbal formulas. Main patent formulas: Wen Dang Tang, warm the gallbladder decoction. Qi Ju Di Huang Wan, Remania, Seeds plus Chrysanthemum and Lychee. These are few basic formulas used for some common degenerative eye conditions. There are plenty of Chinese herbs companies that will make up these formulas. List of recommended formulas and suggested dosages are found in Appendix 2, and companies in Appendix 3. You may have the formulas made, but remember that each person is different and should ideally have his or her own formula designed by a trained practitioner who has experience in treating eye conditions with Chinese herbs. Individually, prescribe Chinese herbal formulas versus patent formulas. It takes 4 years of schooling to learn how to write a Chinese herbal formula. The education I received in Chinese herbology was as good as any reputable Oriental medicine school can provide in the U.S. Since I had a strong desire to learn more about formula writing for special conditions like degenerative vision loss, I did postgraduate study at the University Hospital in mainland China. Many other practitioners have done the same. Seeing how Chinese herbalists create and prepare formulas in China is something that all herbalists should experience. It greatly enhances both knowledge and skill. Despite recent press, Chinese herbs are safe if used correctly. Chinese herbal formulas are written by qualified practitioners trained in Chinese herbal medicine. The practitioner writes the formula based on the diagnosed disease pattern. Only a well-trained practitioner is capable of pattern discrimination and writing the correct formulas. Many people wish to try to heal their eyes on their own. The Chinese patent medicines found in the herb shops in the Chinatowns and Asian food markets can be placed to start. They are mild enough to experiment with. If you get a bad reaction, stop taking them immediately. If you get good results using them, that's great. Following is a table of some Chinese patent formulas that can be beneficial to certain eye conditions. Side effects of Chinese herbal medicine. Chinese herbs can have some side effects. Although this is rare, most side effects are digestive and simply the result of the body's detoxification mechanisms. If symptoms don't resolve in a day or two, the formula may not be the right one for you. Generally, you can tell if you are not receiving the right treatment or formula. If any of the following conditions persist or worsen: sleep disturbances, radical appetite shift, indigestion, poor elimination, significantly reduced energy level, mood changes, or bad moods. I would like to point out once more that although taking Chinese patent formulas may be useful to some extent, it is always best to have a professional Chinese herbalist evaluate your condition and prescribe the most appropriate herbal formula for you. Most cases of degenerative vision loss reflect deeper imbalances. I often find that using strong herbal formulas initially is best to be followed up with less potent formulas as maintenance. This is it for Chapter 4. Thank you for listening. Side effects of Chinese herbal medicine. Chinese herbs can have some side effects. Although this is rare, most side effects are digestive and simply the result of the body's detoxification mechanisms. If symptoms don't resolve in a day or two, the formula may not be the right one for you. Generally, you can tell if you are not receiving the right treatment or formula. If any of the following conditions persist or worsen: sleep disturbances, radical appetite shift, indigestion, poor elimination, significantly reduced energy level, mood changes, or bad moods. I would like to point out once more that although taking Chinese patent formulas may be useful to some extent, it is always best to have a professional Chinese herbalist evaluate your condition and prescribe the most appropriate herbal formula for you. Most cases of degenerative vision loss reflect deeper imbalances. I often find that using strong herbal formulas initially is best to be followed up with less potent formulas as maintenance. This is it for Chapter 4. Thank you for listening.